what were they, what progress have we made, if at all, and what continue to be our challenges. Advance na yore. Okay. If we look at the map of corneal blindness and the transplantation readiness, as it were, India is perhaps well equipped in both. We have the highest magnitude of corneal blindness in the world, and we are also in some sense very ready to really tackle the problem by doing the required number of corneal transplants in our country. So the question always has been, how many do we have to do really to tackle the problem of corneal blindness in our country? The last year's performance, if you look at it, we performed between 25,000 to 30,000 transplants across the country, and our eye banks have harvested around 50,000 to 60,000 corneas. The need is, it is estimated that we need to perform around 100,000 corneal transplants a year to meet our demands. And that's just a guesstimate. We really don't have accurate numbers. We believe 100,000 will have significant impact, and to achieve that we have to harvest 200,000 corneas approximately. When we consider what are the basic requisites for success of corneal transplantation, it's the quality of the donor cornea that we use, understanding of the recipient pathology, and to really understand more than where to do, where not to do a corneal transplant, even if there is a corneal opacity. And the third is a whole host of care issues, including the very important follow-up care. I think over the past 20 years, I think we have succeeded in putting a framework in place. We now know what a real eye bank means and the standards that are required for each eye bank. And we believe we have about 15, 20 of these really top-class eye banks, although the numbers suggest registered eye banks in hundreds. We have a cluster of cornea centers in our country, and many outside the cornea centers practicing corneal transplant surgery. We have education programs that train cornea specialists. And we also have models of delivery of cornea care. What I think today we need is optimal utilization of the corneas that are already available. There's always a concern that most eye banks, all the corneas harvested are not being used. That means significant scaling up of what we have to do. Regulations remain a hurdle for us. Despite all the limitations, we have made some progress. So the available corneas are about 50, 60,000. And when you apply that against active corneal transplant surgeons, this is the number that I got when I surveyed some of our cornea centers, the Eye Bank Association of India. We seem to have between 900 and 1,000 surgeons who perform corneal transplants in our country, but only 50 trained corneal surgeons, only 50% of them seem to do any kind of corneal transplant surgery. And from our own eye bank, the 270 or so that we distribute corneas to, only 20 seem to be very active, doing more than a critical number. So I believe the first step is to increase the optimal utilization we need more surgeons to participate actively in corneal transplantation who are already trained and can perform corneal transplantation surgery very well. If we look at the future, we have to perhaps make sure every single ophthalmology residency program, of which there are hundreds in our country, should have an active corneal transplantation program, which they don't today. And every tertiary care hospital should also have an active corneal transplantation program, everyone having at least 1 to 2 well-trained cornea specialists in their faculty. And we also need many mentor institutions with comprehensive cornea programs. It's not just doing transplants. You need supportive services like refractive surgery, contact lens service, an eye bank that supplies high-quality corneas, the training and medical care of corneal diseases, microbiology and pathology support. Suppose we have 10 leading cornea centers, each doing 2,000 corneas a year, transplants a year. We reach about 20,000 with them. 200 medical colleges, if they do 200 each, 40,000. Another 200 independent corneal surgeons can contribute to another 40,000. And each of them also put in place a better follow-up system with their referring physicians and their networks. That will probably be the first step that we might consider. Because when you educate a person, you can change a life, but when you educate many, you can change the world. Cornea specialists and ophthalmologists in practice both need to be involved to make these services available, accessible, and affordable, enabling care with a greater reach. This quote is more applicable in the area of corneal transplantation than perhaps any other area of medicine. Medicine is a life of responsibility. Thank you.